Again, thank you all, everyone, for joining us this morning, this beautiful Wednesday morning. My name is Desiree Lakey. I am the program coordinator here at the North Carolina Office of Violence Prevention, and we're really excited to have you all here for this webinar discussing evaluation, why it matters, and how to plan for it. Excuse me. So, for our agenda for today, I'm just going to go over a brief introduction of our office. I'll go over a couple of housekeeping things, and then I'll do a presentation, or I'll do a presentation. Our speakers will do a presentation. I'll facilitate a Q&A, and then we'll have a closing as well. And actually, we'll go ahead and do housekeeping things first. As you may have noticed, everyone's mics are muted and cameras are turned off. This is intentional to keep the focus on the speakers today and the content. So if you have questions specific to the presentation, we're going to ask that you please put the Q&A or any questions that you have in the Q&A function. You should be able to see this using the Slido feature. So on your screen as a participant, you should be able to see Slido where it's next to that like little person chat kind of thing on the bottom right hand of your screen. And then if you click that, you should be able to see Q&A, and you should also see polls there as well. If someone or anyone can't find that or you can't see that, please let us know in the chat and we'll try to see if we can troubleshoot along the way. But that is where we'll want you to put any content specific questions. So in the Q&A function, just to try to keep those separate. Our speakers today will be engaging with you all, and so sometimes things kind of get a little confusing with actual questions and if you're responding and engaging with the speakers. So if you could just put your content specific questions in the Q&A function and keep all your content and engagement in the chat function, that would be really helpful. And so yes, that's where polls will be. And then the webinar is also going to be recorded. So if you want to go back to this content or maybe want to share this with any staff, we will be recording this and we'll be posting it to our website. We typically take about a week for it to be posted to our website, and we usually send out the link within a week as well. So you'll have multiple ways to know whenever that recording is ready. Excuse me. And so just for those of you who are not aware of our office, the Office of Violence Prevention is housed under the Department of Public Safety. And our mission is to coordinate efforts across the state to reduce violence, harm from violence, and firearm misuse. And so we work towards this mission by centering the public health approach, engaging in cross-sector collaboration, and supporting local communities in deploying evidence-based programs and strategies. And as a starting place, our office has narrowed in on community violence specifically as our initial focus for our efforts. And so within our strategic plan, we've identified 3 primary goals that will guide our office's efforts around supporting and enabling community violence prevention work across the state for the next couple of years. And so as you see here, one objective that one objective that we've outlined in this plan is to enhance understanding and the use of the public health approach. So if you're aware of the public health approach or you attended our webinar in April discussing the model, then you know that one of the components of this model is the need for evaluation to better understand, prevention programs, the processes, and measuring impact. So we want to provide an opportunity for violence prevention professionals to learn a little bit more about what it looks like to evaluate programs, best practices, and how to plan for it. So we have 3 lovely speakers here today, and I'm just going to briefly introduce them. Excuse me, I apologize. I'm going to briefly introduce them, and then they'll get into their content for today. So Dr. Josie Cave-Siverman is an injury prevention epidemiologist with subject matter expertise in gun violence research. She is deeply interested in modifiable risk and protective factors for firearm violence, particularly among vulnerable populations. With her background in nursing, Josie is uniquely qualified to ask research questions surrounding health policy and violence prevention. Over the past decade, she has measured the effectiveness of policies that limit firearm access for people with a history of juvenile offending and or mental health hospitalization, studied the implementation of firearm dispossession policy, and identified diagnostic risk factors for suicide. Dr. Sarah Travis Kagan is a social scientist with a focus on structural approaches to preventing violence. Her work is focused on creating safe, stable, equitable, and nurturing relationships and environments. She led efforts to prevent childhood adversity and sexual and intimate partner violence at the CDC's Division of Violence Prevention Research and Evaluation branch for 5 years. Prior to that, she conducted domestic and international quantitative and qualitative research on gender-based violence and HIV prevention at measure evaluation at UNC Chapel Hill and University of California, San Francisco Center for Prevention Studies. She also managed reentry grants for the City of Oakland's violence prevention team and began her career in communications and development for human rights and environmental justice organizations. And we also have Gerald Gibbons, who is currently the founder and CEO of Raleigh Boots on the Ground, which is a community involvement and capacity building nonprofit specializing in violence prevention. The mission of their organization is to break the cycle of violence and build a thriving community of rooted leaders in Wake County through prevention, intervention, healing, and advocacy. So now we're going to have our speakers continue with their content.
Thanks so much. I'll just share my screen.
Thanks, Sarah. Yeah, there we go. While Sarah's getting that set up, I'll kind of begin our introduction. So I want to thank the Office of Violence Prevention so much for having us today. We're very excited to be able to do this presentation. As Desiree mentioned, my name is Josie Cave Sarama, and I'm working with Sarah. And we're joining you from the Southern Injury Prevention Institute, which is a small consulting business that was started earlier this year to help violence prevention organizations with evaluation and planning. We're located in North Carolina, and as you heard from Sarah, we have a ton of combined experience from working at UNC, Duke, RTI International, and the CDC, and now we're just continuing to do that same work, but under a different name. Desiree also mentioned that we're joined today by Gerald Gibbons from Raleigh Boots on the Ground, who's been very gracious about agreeing to let us use his organization and their excellent work in this presentation as a local example. So we'll be hearing more about Boots on the Ground in just a minute. But before we get kicked off with that, we're going to be using a few audience polls throughout this presentation, and we wanted to put the first one up now, just to do a little pre-poll of people and their understanding of evaluation. So let's get that going. There we go. Does everybody see the poll? It's how comfortable are you with evaluation? And there's a couple of options there for people to put their responses in. And we'll give it just a second. All right, great. Looks like we're in the mostly in the I think I can do it if you can remind me what it is category. I can get myself started, a little bit of help. That's fantastic. Okay, that gives us kind of a starting point to work with. Maybe someone can like take a screenshot of that or something. Okay, I think a good place to start is why is evaluation important? And we came up with sort of 4 main related categories for that. You might want to do an evaluation to refine your program or to do some quality improvement of your program so that you know that you're having the effect you want to have. You might want to do it just to document your successes and your lessons learned. So you have a program that you implement on a periodic basis, like a backpack giveaway or something like that, that happens every year, but you want to kind of remember from year to year, how did this go? What can we expect? Where do we want it to go? You also might want to be able to demonstrate your impact to the communities where you're working or your funders, just to make sure that you continue to retain their support or gain additional support. Or you might want to scale up your program, and you need some evaluation data to help guide you in how to do that and where to expect the most effect. So that kind of gives us a foundation of why we're doing evaluation. And with that, I'm going to turn it over to Gerald to get us going in understanding Boots on the Ground and their excellent work. And then Sarah will take over after that to talk a little bit more about evaluation planning. So all yours, Gerald.
Good morning, everyone. My name is Gerald Givens, and I'm the founder and CEO of Raleigh Boots on the Ground. And it's an honor to be here with you all today. I grew up in St. Louis and Detroit. There were times where I couldn't even attend school because of gun violence. In my lifetime, I've lost 8 family members to gun violence. I've lost my grandfather, my uncle, my brother, and 5 of my cousins. At the same time, I've had the chance to live in Japan, where gun violence has been eradicated. I've lived in England, where gun violence is rare. And I spent about a month last year in Australia, where they haven't had a mass shooting in more than 30 years. And what I've learned is we don't have to live like this in the United States. So as we begin this conversation, I want to kick it off with a very important thought that I always share with every audience. Freedom requires safety. If we can't be safe, we can't be free. Safety isn't a privilege, it's a right. And together we can build a society where hope is louder than gunfire and where every child has the chance to dream beyond survival. In our organization, Boots, we have 3 core values: family, because healing starts at home; community, because together we're stronger than any challenge; and opportunity, because every person deserves a path forward. And our mission is simple: to break the cycle of violence and build a thriving community of rooted leaders. And we're here today to talk about the impact and how we're creating success together. Next slide. So Wake County is home to about 1.2 million people across 12 different vibrant municipalities, from Raleigh to Cary, Fuquay Varina to Zebulon. But behind these numbers are real families, parents working 2 jobs, kids walking to school, neighborhoods coming together to protect one another. Our work starts at the heart of this community because we believe solutions must be local, homegrown, and built on trust. Next slide. So let's take a look at the real problems that we're dealing with here. Our community is hurting. These numbers provided to us from the North Carolina DHHS show what we see on the ground every single day: the impacts of gun violence, families living through trauma without resources, neighborhoods struggling under economic and social pressures. From 2010 to 2019, there were 1,268 violent deaths. 931 were suicides. 283 were homicides. We also see that homicides are impacting Black males most, and suicides are impacting white males most. But what we also know is data doesn't define us, it guides us. It tells us where to focus, and more importantly, where we can make the biggest impact. Next slide. So, and at Boots, we basically have 4 pillars that keep us going in the right direction: violence intervention, where it's mediating conflicts and negotiating ceasefires, and then shifting cultural norms. We also have a hospital violence intervention program with our #1 trauma center in Wake County with Med Hospital. Cognitive behavior therapy, helping individuals reframe their thinking and reclaiming their future. We work with our schools, we work with clergy, we're working with universities. We built together pretty much a 50 course curriculum that we'll implement over the next 3, 4 years. Survivor support services, housing, jobs, trauma therapy, um, you know, healing requires stability. And if that's one of the biggest things that we've been able to see in doing our work. And that last piece, ecological systems, improving access to resources and transforming entire neighborhoods. I can't tell you guys how many studies I've read. Things like trees and how much the more you plant trees in the community and how those things help reduce the violence inside the community and how people feel and make them feel safe. Every single one of these solutions is evidence-based, but they're also people-driven. We don't parachute into solutions, we build them with the community. Thank you.
Thank you, Gerald. I every time Gerald and I talk, I end up crying. I love hearing about your work and how passionate you are, and what a positive impact you're making.
Thank you.
Yes, so thank you, and thanks everyone for joining us. I noticed earlier that we have folks from all over the country, which is really exciting. Um, okay, so moving forward, we're going to talk through some of the pillars of evaluation, and we're going to use boots on the ground as an example to try to help all of this make a little bit more sense. Before I start, I just want to name that I know evaluation can feel a little intimidating, but honestly, I mentioned this to Gerald the other day, that sometimes I feel like our research and our in violence prevention in particular is a little bit like saying, is like a little bit like documenting that like water is wet. Like, did you know that violence is bad for you and that it's bad for our communities? Like, yes, I did know that. But there are very powerful things we can learn from evaluation, and it can be a really important tool to talk about with our funders, the media, with our communities and local officials. And also, um, I want to name that as you go through and do your own evaluations, I'd like to encourage y'all to think about these as kind of like living documents. Like, you don't need to get them perfect the first time, and you can revisit them and improve them as you need and as things change, because they will change in your organization and in the world that we work with. So we'll talk about stakeholder engagement and partnerships, theory of change and logic models, evaluation questions. So what can you answer as you evaluate your programs? Josie and I will also talk about indicators, data collection methods and analysis, and then we'll end with dissemination. So like sharing your successes and victories, which Boots on the Ground is also amazing at. So first, partnerships. Why are these important? Okay, sometimes it's tempting for people like me to sit by myself with the office door closed and my headphones on and write an evaluation plan by yourself. But don't do that. Engage your teammates and partners throughout your community. This can help you and your organization understand community priorities. It can facilitate access to data. It can help you identify like what's already existing in your like ecosystem of violence prevention and what's missing. It can help you, working with your partners can help you better understand your data and the nuances in your community. And it can also, your partners can help you figure out like, how do we want to frame and message our successes or our challenges. Here are some examples of partners you can engage with in this process. So obviously your organizational leadership and your implementing staff, your partner organizations, direct service providers, law enforcement, local businesses, your healthcare systems. And so just for example, like if you are thinking like, okay, we want to be able to reach like every young person under the age of 18 that's discharged from the hospital with a gunshot wound. Your partners at the hospital can be like, that's amazing. Like last year, that was 10 people. And you can be like, great, we have the capacity for that. And then they can also say, but we had 200 other folks that were over age 18 that were also discharged from the hospital, and we think they also need support. And so then, because of the partnership, you can be like, oh, okay, well, maybe it's not just youth that we should be focusing on, but adults also that are experiencing gunshot wounds. Next is a logic model. I think people get like totally scared of logic models, but they're actually like the idea behind them is pretty simple. With a logic model, you're identifying your problem and you have your problem and then you have your goal. Like, what do you wish to see in the world? And then, like, what are the strategies that are going to lead you to that goal? I really like this particular model because in addition to your problem, your goal, and your strategies, it also takes into account like what is happening in your community and like what are some assumptions that we make about how people behave or how the world works that's going to influence our strategies and our problems and our outcomes. So we'll use boots on the ground as an example for this. So Gerald talked about all of Boots on the Ground's like amazing work. For this, we focused a little bit more narrowly. We focused on their violence prevention work. We've focused on their hospital-based violence program, on their street outreach, and on building the violence prevention ecosystem. So we heard Gerald talk about the problem that adults and youth are deeply affected by cycles of violence in Wake County, and that the desired result is to have a safe place to live. And so we refined that a little bit more to talk about, Boots on the Ground, refined that a little bit more to talk about reducing violence and building a stronger infrastructure with adults and youth to help prevent violence and intervene, and also to improve relationships with local law enforcement agencies. And in addition to the problem and the results and the strategies we talked about, we also talked about the assumptions that Boots on the Ground is making as they create these strategies. So like all types of violence are interconnected, that like violence and safety and well-being are affected by social determinants of health. So things like access to safe housing and transportation and education and safe jobs. Also, some assumptions that victims of violence are vulnerable to future violence and that victims of violence need additional support when they're released from the hospital to stay safe. We also named some community assets, such as the Boots on the Ground team. Their team is full of like really amazing, dedicated individuals that are working so hard for their community, as well as, for example, clergy and law enforcement in their communities, their ability to not just work with the victims, but also to try to support the family. We identified some things that were missing that kind of can limit their work or that they need to work around or need to focus on building. And finally, we named some like outside influential factors that like make their work either more difficult or easier that they have to respond to. Like we have to respond to the fact that access to guns is very easy, for example, in the work we do, and that funding is uncertain right now, that our communities are dealing with homelessness, that while law enforcement has some like great skill sets, there are also challenges with like community and relationships, as well as, again, these kind of social determinants of health that are making it harder for people to live safe lives. And then we turned all of this into like a kind of more visual representation about the work that Boots on the Ground is doing and their strategies, and then the individual and community outcomes that they're hoping to achieve. So oftentimes with logic models, you see these like logic models that have like a bunch of columns that go from left to right, and they have lots and lots of tiny words, and they're very specific. And those are super, super helpful for evaluation. And I have some examples of those at the end of our slides, which we'll be sharing. But for things like a PowerPoint presentation where people can't read lots of tiny words, or to like communicate with your community members or elected officials about kind of the work that you're doing, I like these kind of visual representations. But I'm going to pause. I know I've talked a lot. Gerald, do you have anything to add to this kind of initial work we did around creating a logic model together?
Yes, I really, really like this so much. It gives me the opportunity to be able to look and evaluate our organization and making sure that we're putting together a quality program and getting the success that we need for the community that we serve. And I just love just all aspects of how this logic model will help shape what we do going forward.
Good. Um, okay, perfect. And I forgot about our polling question. Let's put up our next polling question, which is an open-ended question, actually. It's not really a poll. But the logic model is so much based about like what you are hoping to see, like what you want your work to accomplish. So if you guys could take a minute to share what your vision of success would look like, we would love that. And then the next thing we'll move to is what we can answer using evaluation. I'm especially bad with long silences, so I'm just like watching the seconds go by to give y'all long enough time. Okay, so what can we answer with evaluation? So there are kind of four main types of questions, and this comes from the University of Kansas's Community Toolbox, which is such an amazing toolbox for evaluation. I would really recommend it. So the four main questions are like planning and implementation issues. Like another way to think about this is quality. So is the work that you're doing high quality? So for example, if you are trying to reach young people, are the people attending your events actually young people, and do they like what they're hearing at these events? The next is assessing attainment of objectives, or another way to say this is were you able to do what you planned to do? If you planned to reach 100 people, did you reach 100 people? And then the last two are impact. So for impact on the individual, on the participants, did your work make them safer? And then impact on the community. So did your work make the whole community safer? And we'll go through each of these with examples from boots on the ground. Okay, and before we get started, I just want to talk through like what a SMART indicator is, because we'll talk through each question and then some indicators for each of these questions. And then Josie will lead us through like what kind of data we can use to answer these indicators. So you guys probably have heard somewhere about SMART indicators. So indicators that are specific, measurable, achievable, relevant, and time-bound. And so I love this tool because anytime I write an indicator, I like go back and look at this and I'm like, oh, I forgot something. And so just having this helps me kind of craft like the best indicators possible. And we'll talk through some examples of this. And as we're talking through this example, y'all can think about what your measure of success was and how we can make it more specific. Because So that's going to be our next poll. We'll put that up in a couple of slides. Okay, so for our planning and implementation, or like our quality of the program delivered, was it acceptable? Was it feasible? So one example indicator is, so let's say that as a goal could be 95% of participants in boots on the ground events that take place in 2025 live in highly impacted communities. Another indicator or goal could be that 80% of community members identify boots on the ground as a trusted resource in 2025. Okay, and actually, as I'm looking at this second one, we could make even more specific by saying community members in areas that boots on the ground works, for example. So we've made it time bound. So we specified the year. We made it specific. So it's, they live in highly impacted communities where boots on the ground works. I don't know if these numbers are achievable, but hopefully they are. They're relevant because this reflects the work that Boots on the Ground is doing. And we can, answer these questions using like data like program implementation data. So like the monitoring data that many programs collect anyways, because their funders want to know what they're doing. We can use interviews, surveys, we can use some mapping tools. Anything to add about this one, Gerald?
Yeah, we're really getting into mapping this year, where we're looking at where individuals live and where they were impacted by violence at, and seeing the correlation in between that as well.
Mm-hmm. Yeah, that can really help, like target. Help like focus where work can happen and where resources are needed. That's amazing.
Exactly, exactly.
So for the next example, so are we meeting our objectives? So was the program delivered as planned? So for example, if a goal or indicator could be to serve 225 victims of violence that were discharged from Wake Hospital in 2025. So again, we have the time, we have a very specific number and a specific like type of person and where they're from. And then Boots on the Ground could work with their local partners to understand, and also with their own team to understand, like, is this feasible? Is this the right number to shoot for? Things like that. Another example can be holding 10 crucial conversations in 2025 with community leaders, clergy, business folks, and activists. And again, this data can come from monitoring and program data, surveys, things like that. Anything to add for that, Gerald?
The community conversations are just absolutely vital, where we bring in members of our community, law enforcement, business leaders, clergy, and it's not so much as a large group from the public, but specific people who are active and in getting things done. For an example, we noticed that there was a lot of violence taking place in downtown Raleigh, and we all wanted to find out what's causing this. And through our community conversations that we were hosting, we were able to identify that there were teenage girls who were homeless that was sparking a lot of the violence that was taking place. And then we all got together and got solutions, and we got those girls off the streets. That's why the community conversations are so important with being able to make the community safe.
That's great. And I love that. Actually, let's go back to that for the community impact too, because I feel like that's such an important community impact that y'all can document. Okay, so for individual impact, so what difference did the program make to individual participants? So an example could be that 95% of boots on the ground participants report an increase in their perceived sense of safety within 6 months of being discharged from the hospital. So again, that's kind of, time bound, and it's a specific number of people, and you're being clear about what you're hoping to change. You can use surveys or interviews, administrative data, so for example, hospital data, and comparison groups, which Josie will chat about in a minute. And then, so community impact. So I love this example that Gerald gave about how these conversations can result in this problem solving and helping rehome these girls, then prevented violence. It's so tricky measuring like violence prevention because you want the number to be 0, but then you don't have anything to count. And it's hard to like say things that were avoided, but it's so powerful. So for community, so what difference has your program made to the community as a whole? So one example can be like a 30% decrease in gunshot injuries in Wake County compared to the previous year, or you can compare to a similar county, which Josie will talk about. And often this is secondary or administrative data, although the example that Gerald just gave us, that would be like some qualitative data, like interviewing the folks would be able to tell us about that positive community impact. Gerald, do you have any thoughts about the individual or community impact?
Absolutely. Most recently, our U.S. attorney let us know that collectively, with all of our work together, we've reduced gun violence in our community by about 37% in our community. And so that's the type of smart indicators that you want to be able to have on your mantle for achievements.
Absolutely. And so I'm not sure if the polling question is already up, but if it's not, think about what your success was that you envisioned earlier, and think about ways to make it specific, measurable, achievable, relevant, and time bound, and rewrite them in the poll. And I'll give you all a minute to do that, and then we'll start talking about data.
And while people are thinking through that, I'm happy to go ahead and get going on data if you'd like. Oh, this is still you, Sarah. Go ahead. Sorry.
Yes, almost. We're almost to you, Josie.
So eager.
Josie and I love data. Okay, so there are two types of data, like very generally. So qualitative and quantitative. In the field we talk about we need to change hearts and change minds to increase support for violence prevention work. And I like to think about like qualitative work really speaking to the heart, and quantitative work kind of speaking more to the mind, although of course it's all related. So qualitative data looks like interviews or testimonials from folks, and quantitative is what we think about, with the numbers from program data, like we held 10 community events, or surveys like 95% of our participants agreed with X, or administrative data like the number of gun violence in our community reduced over the year. And so I just wanted to here is an example of how we could put all these different kinds of data to share some success. So for boots on the ground, we could say, for example, they served 225 discharged patients in 2025. a certain percent of participants reported increase in perceived community safety compared to last year. And Gerald just gave us this amazing indicator that, we had a reduction in gun violence by 37% in the communities they're working in. And Gerald, when he started introducing boots on the ground, he made this really amazing point that there are real people and real communities behind all of these numbers. And he shared the most amazing story with us about actually, Gerald, why don't you share this story? I feel like it's so powerful.
Sure. So, um, in the middle of the night, about 40 shots went into a home where three children had to be airlifted to Wake Med Hospital. And I think it was a 10-year-old, an 18-year-old, and a 19-year-old all had to be airlifted, and Wake Med saved all of their lives. And we had to basically relocate two families to two different parts of North Carolina. And I'll never forget getting this text message that shared on the screen where the mother wrote to me, "My son slept for the first time last night because he finally felt safe." And I always I have this right above my computer to remind me to keep going even when days when I'm thinking like, what's going on here. But that's what it's all about here, being able to make sure that these victims and survivors and our communities feel safe.
Yeah. Thank you, Gerald. All right, Josie, I'm passing it over to you.
Okay, so when we're talking about data, we've talked about like types of data, but we also need to talk through um, ways to collect data. So there can be primary data and there can be secondary data. Primary data is the data that you collect yourself, and secondary data is the data that you're able to get from your partners, maybe law enforcement, administrative data, or hospital records, administrative data, that sort of thing. So it's data that you're not collecting for yourself, but it's data that is meant to that's not necessarily meant for research purposes, but you can use it to help evaluate your measures. One thing to consider when you're making data choices is that primary data can be resource intensive, and it can be expensive to collect. So you want to kind of reserve that for getting good information that you can't find otherwise. So an example might be, we heard earlier about how Boots on the Ground serves high-risk individuals at Wake Med's HVIP once they've been discharged into the community. We all know that these people who have been discharged are at high risk for re-injury. So Boots on the Ground might want to know the rate of injury among participants that experience the rate of injury that they experience in the first year after their discharge. And they could do that by looking at, say, emergency department records. So that would be secondary data. But that's not a very sensitive measure. You have to be wounded pretty badly before you go to the emergency room. So it might be better to do a survey of your participants. And then you could ask questions about how many aggressive verbal arguments have you been in, how many fights where weapons were presented but not deployed, when were you actually injured but didn't go to the emergency department, and figure out the better scale for that. You could also do interviews with people, and from doing the interviews, you could understand what were the circumstances leading to that, and you also might get some insight into violence that didn't happen. So oh, something was coming up, but I used the resources that Boots on the Ground provided to me, and I was able to avert that violent situation. So those are situations where primary data might work out a little better. Next slide, please. So a note on primary data collection is that we need to be really careful when we're doing it to not re-traumatize people. So when we're doing interviews, with people soon, shortly after they've experienced violence, that could be really difficult material to talk about. So something to keep in mind there. You also want to protect your participants. You don't want to collect identifying information that you don't need. Sometimes we have like a way of having people's identity matched to a study number, and the study number isn't on their actual data, and then we keep those things separate so that if a questionnaire falls on the ground and the person's abuser picks it up, they won't know that it's actually, the person, the specific person. So we want to protect people that way as well. And institutional review boards, or IRBs, are specifically set up to help with that data collection and make sure that you're prioritizing people's safety. And so you might want to consider using an IRB in situations of high risk like that. There's some other secondary data potential assets that I'll just mention here really briefly. The North Carolina Violent Death Reporting System has a great dashboard. The North Carolina Firearm Story Map, State Bureau of Investigations data, or National Incident-Based Reporting System data, discharge data or emergency department from NC Detect, or the Youth Risk Behavior Survey are all good sources that you may want to consider also using in evaluation for secondary data. And then we get into analysis. So you've got all this data. I kind of think of it as unformed clay, and you need to make something out of it to understand what you've got. So depending on the analysis depends on the type of data that you have and what you want to get from it. In thematic analysis, we usually reserve that for qualitative data. So if you have a bunch of interviews and you want to know what did you get from it, you can look for common themes across interviews, and there's very specific methods for doing that. An example of a theme that might rise up from a set of interviews that you do from your population might be, you note that participants expressed feelings of safety rooted in having their basic housing needs met. So that might be a theme that you see across interviews. But you could also be wanting to look at descriptive data. So that might be from your surveys, or here's another example. For example, in neighborhoods where boots on the ground is most active, 25% of 911 calls for service were related to safety concerns in 2025. So that's kind of a snapshot in time. It gives us an idea of, what the community is thinking about safety. That's using secondary data, 911 data. But we don't know, is 25% a lot or a little? Is it getting better? Is it getting worse? So we might want to do some comparisons in order to inform that. So in that case, we might say, looking at comparisons in neighborhood A, where boots on the ground is most active, 25% of 911 calls for service are related to safety concerns, compared to a similar neighborhood B, where boots on the ground is not currently active, and they have 35% of 911 calls for service related to safety concerns. So then you can be like, oh, okay, maybe 25% is good. Or you could look over time. So you could say in neighborhood A, in the year before boots on the ground started providing services, 30% of 911 calls for service were related to safety concerns. And now in the year after boots on the ground has started working in neighborhood A, this went down to 25%. So we call that pre-post data, looking beforehand and afterwards. So comparisons can be made across geography, like I used the example of neighborhood A or B, but it could also be across counties. You could compare your county to the state overall. You could compare your state to the nation overall. It could also be made over time. That's the pre-post. Or I think a survey or a design method that's very underutilized is what we call a step wedge, which allows you to combine time and location data. So if you have an intervention like a program that you want to roll out in 5 different communities, you could stagger the rollout over time, and then for maybe over 3 years, and for 3 years you collect data from all 5 communities, but then over time, every 6 months, you're rolling it out in a new neighborhood. Well, then you have comparison across neighborhoods and pre-post, which is kind of a nice way to be able to really assess the impact that you're having. All right, so when we're thinking about doing evaluation, Sarah had a slide earlier that had all the different stakeholders, and that helped us sort of think about all the people that could be involved in planning our evaluation and collecting data, what type of data we should collect, what type of research questions we should be thinking about. Also, when you're thinking about that, your evaluation, you might be thinking about someone to help you with the analysis. And so that can be handled in different ways. Some programs have an internal team member with statistical background, and they work with that person. Some programs work with external consultants like Sarah and I. And then some programs choose to work with an academic partner or a university, which we are blessed to have very many universities in North Carolina that can help with that purpose. And the nice thing is a lot of those universities are able to do that at a reduced rate or even for free if you're working with a student and they're using it for a practicum or something like that. So definitely something that Sarah and I could advise on a bit. Also, speaking of free, we'll be, that we're having the Office of Violence Prevention conference coming up this October 27th through 28th. So I hope everybody's registered for that. And as part of that, we'll be offering office hours. Sarah and I will be to talk about evaluations with specific programs. So you can sign up to have a half-hour slot or an hour slot with Sarah and I to kind of like get kind of some of these conversations going. It's not long enough to write out a full evaluation plan, but it might be long enough to kind of get you started. And then we would have a follow-up, offering a follow-up phone call with that also. Okay, next slide.
Yeah, so I'm going to finish up talking about dissemination. Desiree, do I have time left? Are we at time?
We're at time. If you could just wrap up, and that'd be great. We can do Q&A.
Okay, perfect. So we have a quick polling question about how comfortable are you letting people know about the good work you're doing. So I'll just name, please share your successes with your community. It's an important way to build trust. They're trusting you with all of this important, difficult work, and sharing your evaluation results, what you've learned, what you hope to do better, what your victories are is really important. Also with your peer organizations, with the media, social media, and of course with your funders and your local officials and leaders to get more resources. I don't have time to go over this really, but Boots on the Ground does amazing media work, and I really would just encourage you all to create a media plan. So the key messages are develop relationships with local reporters and social media influencers, create some templates for your social media so it's easy to get that stuff out quickly. I mean, maybe you have young people on your staff that like working with social media. I find it very I'm an old person, so whatever, but templates can really help you get that out quickly. Press releases, op-eds, pitching features, especially the work that we do about violence prevention. These feature stories that we can pitch to reporters can be a really powerful way to share our work and the importance of our work. Think about like holidays, legislative events, anniversaries that can be hooks for your press releases or your op-eds, as well as your own work, your own events, your own policy work, programmatic work. And then finally, in addition to celebrating your wins, yours and others, because if that community can do it, we can do it, for example, be prepared for crises. It's always, of course, very difficult to anticipate when a crisis is going to occur, but the sad truth is that we know they're going to happen. And so we can be prepared for when they happen. So we can both support our communities, but also be able to use that crucial time to get people to really support violence prevention and a more compassionate narrative about why violence is occurring and what we need to do to stop it. And I'll just point y'all to the narrativeinitiative.org and the socialchangeinitiative.com. There are just a couple of places that really, really talk about narrative and why it's important to like control how we talk about narrative, or to at least, I mean, how we talk about violence. Really starting with our shared values, identifying both the problem, but also the solution, and including a call to action. That could be a whole nother webinar, but thank you so much for your time. We are so appreciative of y'all being here. Gerald, thank you so much for joining Josie and I. It was so fun to work with you.
Anytime,
And
any place.
awesome. And we have one final evaluation question for you, polling question. And I'm going to stop sharing so we can start taking some questions.
Yeah, thank you so much, Sarah, Gerald, and Josie. If you all can put your questions within the Q&A, if you're able to see the Slido, if you can't see Slido, you can go ahead and put them in chat as well. But while folks are typing their questions, I just wanted to re-highlight that Josie and Sarah will be at the conference providing some one-on-one sessions to kind of help folks either get started with their evaluation plan or make, tweaks, reviews, and things like that. So we'll be providing some additional information within the coming weeks to all the folks who have registered for the conference. And we'll provide, a sign up registration process and additional information. So if you are registered, please look out for that email coming soon. And then, as per usual, stay connected with us, sign up for our listserv, and regularly check our website as we continue to upload resources, and particularly with data, the public health approach, and things like that. And yeah, and then we'll also have a post evaluation for this specific webinar. Callie, if you could put that link in the chat now so that folks can also have that opportunity if they're hopping off early. If you could and submit the evaluation. And then we'll go ahead and take a couple questions. I know we're at time, so if you need to head out, that's totally fine. But if there are any questions that folks would like to ask Josie, Sarah, or Gerald, we'll go ahead and take those questions now. Not seeing any questions in the chat. Just everyone singing y'all's praises.
Thank you.
This was really helpful content. Yeah, if you all have any questions, again, please put those in the chat. If not, we'll wrap up in about a minute or so. So yeah, we'll give you a couple more minutes, and then if not, we'll just close out the webinar.
While folks are thinking about questions, Gerald, do you want to share a little bit about your experience with media?
Yeah, sure, of course. I mean, it's been such a great opportunity to work with all of our media outlets. When I went to go apply for a grant at the federal level, of course, they asked if we had any media clips, and I went back to go research my organization, and I was like, oh my goodness, we got more than 24 media stories, since we've been in action. And now I have an upcoming article that's going to be coming out soon. So I can't emphasize enough, how important it is to be involved with your media organizations. And also that helps to also calm the community down as well, because when the people in the community see that there's active people working on these issues, they reach out, they call, they find out ways for how they can participate, and then it helps just heal the whole entire community and get us going into the right direction.
Thank you for that, Gerald. Yeah, well, it looks like we don't have any questions in the chat or in the Q&A, so we can go ahead and wrap up this webinar. Thank you again, Sarah, Gerald, and Josie for joining us today and providing us with such valuable and insightful information. And yeah, we'll see you all at the conference, so we're really excited for that. And everyone have a good rest of their Wednesday.
Be
Thank
safe,
you.
everybody.